Assalamu alaikum, ladies and gentlemen. I'm Dr. Sana Zera, currently practicing medicine at Jira Postgraduate Medical Center, Karachi, and your host for today. In the views of William Osler, medicine is a science of uncertainty and an art of probability. Hence, these uncertainties give rise to the need of research. Therefore, we bring to you another informative session from our research series. Today, we feel honored to have Dr. Aamir Abbas with us, who will shed light on the topic study design. So, without much ado, let's begin our session in the name of Allah. I would like to request Abid Raza to recite a few verses from the Holy Quran.
بسم الله الرحمن الرحيم إنا أنزلناه في ليلة القدر وما أدراك ما ليلة القدر ليلة القدر خير من ألف الشهر تنزل الملائكة والروح فيها بإذن ربهم من كل أمر سلام هي حتى مطلع الفجر صدق الله العظيم.
Jazakallah. Now we'll have the main speaker of our session, Dr. Aamir Abbas. Dr. Aamir Abbas is a graduate of Khyber Medical College, Peshawar. He has done his master's in epidemiology and biostatistics from Aga Khan University. He has been a faculty member at Aga Khan University and is currently working as an assistant professor of public health at Khyber Medical University. He is doing his master's in health data analysis and IT for Carnegie Mellon University. He has 15 publications to this credit. Before we proceed, there's a comment section where you can ask questions from Dr. Aamir. And now, I'll request Dr. Aamir to please take over and enlighten us with your knowledge.
Okay, thank you very much. Can you hear me clearly? So, before we start, I'm going to share my screen and adjust my screen. And in between, I request those of you who are watching this conversation and this telecast live to please comment on the comment section that if you are able to hear me clearly or if you're able to see my slides clearly or not. That's one thing. Because I just want to make sure that I'm audible clearly to everybody or not. As you people know that today's session is related to study design, we are going to be talking about a number of aspects of study design. And as I wait for the comments from other people, whether they're able to hear me clearly or not, I'm just going to step back and talk about what we discussed in the previous sessions. What we discussed in the previous session was we talked about the research question, how to formulate a research question, what is a good research question and what is not a good research question. We talked about the scope of the research question. We talked about the end user perspective of the research question. We talked about the depth model. We also discussed the fact that the association and causation are two separate words. In addition to that, we also said that we are going to be talking about the PICO and the final criteria. We talked about the PICO and final criteria. And we said that we are going to take the ideas from the session of research question forward and with the help of different examples. And we are going to connect it to different study designs, like what are the terms in the stem of the research question, which when used have different study design implications. So that was a preview from the previous discussion we had. in addition to this, what I will request you people, that I can see that some of the people are live right now, and as I'm seeing the comments, and I can show you like this in the question will be shown in the scene. So I will screen. What I will request you people, that whenever you have a comment or a question, please write them in the comment section, and I will be able to show it like this on the screen. And if needed, I will read it. I will respond to the comment or the question. Along with that, I will request you people to forward this live stream in your contacts to different groups, so that more people are able to join us in this live stream. Uh, because if there are more people, then we will be able to create an interactive environment for and create a better session. The interaction creates values. That's what I believe. Uh, Having said that, I will move forward. These are the objectives of today's session. Uh, I want to, as I told you people, that I will be linking the previous session to the current session. So I will identify the keywords in the research question that link research question to study design. We will try to understand the classification of study design, and we will talk about different study designs that include case report, case series, cross-sectional study, case control study, cohort study, and randomized controlled trial. So that is an overarching objective for this session. Obviously, the study design in itself require a lot of details. Um, we will just be touching on the basic definition of each study design. We will not have the time to go through a lot of details related to individual study design. Having said that, this is uh, a lot to cover in 1 hour session, because we want to keep this session limited to 1 hour in order to ensure that interactivity and the live audience is engaged. If I see uh, uh, that we are not able to cover this material in 1 hour, what I will do, I will divide the sessions into 2 parts, and I will, wheresoever we are able, our time gets completed, we'll continue with that in a subsequent session, a follow-up session of study design. So it can also be divided into 2 parts. So in between, what I'm going to do, I'm going to step back and keep on watching it. And uh, there's a comment. So he's saying that we can hear you and clearly see the slides. Yes, we can hear you. So this is how I want to encourage interaction in each and every point, and I will be asking you different questions in between as well. So I will go ahead with the session, and as I told you that you have to bear with me, there will be a lot of back and forth during this session, uh, as I will be checking a number of things, especially different comments, if there are any comments, uh, uh, and whether I need to respond or not. So let's discuss in the process of research, and by taking the example of smoking and lung cancer. We will take the example of smoking and lung cancer, and we will assume that we are in a time when there is no study has been done on this topic. So what happens, that this uh, there was a sudden finding, somebody suddenly discovered in a way uh, uh, that somehow he got a a case in which the person has was smoking, and the person has a history of lung cancer. I'm sorry, and I have to apologize because I'm not feeling completely well today. If I'm just like taking a pause in between, so I'll request you people to bear with me. Uh, okay, so we what I was saying, that we go back to the time. You just hypothetically go back in the history to a time when the link between smoking and lung cancer is not well established. Okay, and we assume that this link is not established. So how was this link established? Understanding that is critical in to know that how evidence is generated in the scientific world. So what would have happened? That somebody, some doctor, some clinician might have noticed that he got a case or a series of cases where people were smoking, where people had lung cancer, and they had the consistent history of smoking. Okay, so that is how a unique finding was developed, found in the history. Or so if something like that and something unique like that is found in a single case, then you report that in the form of a case report. And if something unique like that is established in a series of cases, then you report that in the form of a case series. As I told you, that we are taking the example of smoking and lung cancer. But what case report and case series are going to do, they are going to generate a question. They are not going to answer any question. So we will generate a question that is there an association between smoking and lung cancer among patients presenting to the tertiary care hospital in Karachi. So this is one example. As you can see from the previous session, the PICO criteria is can be demonstrated in this. The question being phrased like this. I'm not going to go into the PICO criteria, but what is important for me right now is the term association. I told you that the term association, when used, has different implications. So when I use the term association, I have two study design options. I can either choose cross-sectional study or case control study. Okay, so if I am asking of whether there is an association between two factors, then I can either use case control study or cross-section study to answer this question. And in which situation we use case control study, and in which situation we use cross-section study, we'll discuss that subsequently if you get time. Okay. Um, from the point and the point to remember right now, if you use the term association in the stem of the research question, then the study design options which you have are cross-section study or the case control study. And what will happen if you do this study and you develop an association? uh, there are two possibilities. Uh, so as we discussed last time as well, whenever there is an association, that may or may not be a causal relationship. So the next subsequent logical question is that is there any causal relationship between the two factors, which are the smoking and lung cancer in this case? So the subsequent research question will be that we now want to, when we established association, we want to establish causality. And now we will ask whether does smoking cause lung cancer among patients presenting to the tertiary care hospitals in Karachi? And now, as you can see, that we are all asking a causal question. And the study design option right now, which we have in this situation, is the cohort study. Uh, Once we establish a causality, what we do, we intend to find out a treatment for a disease. So when we establish that smoking causes lung cancer, then we will try to find out a treatment. And this is an example of an interventional research question. And I'm going to read it, that does adding veliparib to standard treatment for advanced metastatic squamous non-cell lung cancer reduces mortality as compared to the standard treatment alone? So as you can see that we have established causality. Now we want to find out a treatment, and that we can do with the help of a randomized controlled trial. Uh, and there is a step further to that as well. If you find out that that particular treatment is effective or efficacious, then, and you have a collection of randomized control trial. Some of them are saying that this is efficacious and effective, and others are saying that it is not. So how would you combine the results to generate evidence? You combine the results with the help of systematic review and meta-analysis. So that is how a bit of overview and connecting previous concepts to this discussion. And I'm going to step back and see if there are any questions or comments. Okay, so the question is from Ziaur Rahman, that what is the difference between association and correlation? Again, this is an important question, and I'm glad that you're following it. And I think to some extent, I'm able to communicate the concepts. As I told you, and I have to repeat this point once again, that there, for the sake of simplicity, I used only two terms in the last session, which were association and causation. Okay, but as you have introduced a new term, which is correlation, so I'm going to uh, first of all speak out all the relevant terms. So these terms are correlation, association, uh, causation, efficacy, and effectiveness. All of them have different interpretations and different implications as far as the study design is concerned, and as far as the and the methodological implications are concerned. Now, your question: what is the difference between association and correlation? As I told you, that there are different terms, which is correlation, association, causation, efficacy, and effectiveness. If these are used in the stem of the research question, that they have different study designs application. Correlation is typically found out with the help of a population or an ecological study, which means that the unit of analysis may or may not be an individual. I'm going to explain that subsequently, as well as we are talking about ecological studies, because that is going to come forward in the subsequent parts of my slides. But correlation, when we're talking about correlation, the unit of analysis may or may not be an individual, but in an association, we are for sure that the unit of analysis is definitely an individual, which means uh, I mean, I just, for the sake of simplicity, I will not go into more details of that, but I'll just stick to that point. There is obviously more detail to that, but if I go into, I may not be able to explain it, because typically what happens that if I'm explaining this concept in a classroom setting, what I will do, I will go to the board and draw a few things, which obviously I'm not able to do right now. So for the time being, I will repeat that when you're talking about correlation, the relationship may or may not be at the level of an individual. But if you're talking about association, that relationship or the unit of analysis is definitely the individual. Uh, and I'm glad that you people are asking questions. I encourage others to also ask question, or at least give your comments in the comment section. Uh, so we will summarize our discussion as we have talked about it so far. And I'm going to step back, and we talked about case report and case series. And let's assume that there is a situation where there is neither even a case report or case series. There is a topic of which we are interested in. Then what will happen that a few experts will convene and they will make an opinion about that thing. And that is also considered evidence, but in the hierarchy of evidence, that is the lowest level of evidence. After that, we will talk about the case report, case series, as we discussed, then the cross-sectional study, case control study, cohort study, randomized control trial, and systematic review and meta-analysis of the randomized control trial is also considered as the superior most evidence. So this pyramid is showing a hierarchy of evidence where the editorial or expert opinion lies in the bottom. Then we have case report, case series, uh, case control studies, cohort studies, randomized control trial, systematic reviews, and there should be meta-analysis at the top, which is missing for the time being. Uh, Now, what I'm going to do right now, we are done with let me repeat in front of you the first objective. What the first objective was to identify the keywords in research question that link research question to study design. So as I committed that I'm going to give you examples of some of the research question. Obviously, this is not an exhaustive list. This is not going to be a lot, but I have at least given you some examples of different research question. But the main objective over here was to link the words in the stem of the research question to different study designs. The subsequent two objectives are to understand the classification of study design and to understand the different terms, which are case report, case series, cross-section study, case control study, cohort study, and randomized control trial. Okay, so this slide is showing one classification system, and this is another classification system. I mean, It is taken. This is a snapshot from a book whose link, whose details I will put in the description of this video. But the idea of uh, showing these details is that there are different classification systems of study design. So what I want to emphasize, if you hear or see something which is different from what I'm talking about, just remember that there are more than one classification systems of study design. But what I'm talking about is the most famous classification system and mostly accepted classification system. So I'm going to dive deep into this particular classification system, and I'm going to walk you, all of you, step by step, and we are going to achieve the two objectives simultaneously. We are going to be talking about different classification. Uh, I will be walking you through this classification tree, and at each point, I'm going to explain different study designs which are coming under different classification. So, just from the beginning, you will ask yourself the question that whenever you are classifying the researches or a type of study into a study design, you will ask yourself the question that did investigator assign the exposure? Okay, and if the answer to this question is yes, um, then that particular study or the class, those studies are going to be classified into experimental studies. Otherwise, if the investigator did not assign the exposure, then you have an observational study. So within the observational studies, so this is a big one. Actually, I just want to pause over here and I want to make sure that this concept is correctly communicated. And if you think that it is not clearly communicated, please stop me by writing in the comments. I will ask the question, and I mean, whosoever is doing the classification will ask the question whether the investigator assigned the exposure or not. If the investigator assigned the exposure or decided the exposure, then this is an experimental study. Otherwise, it is an observational study. I will pause over here. I think there's a question in the comments. Okay, so Mohammed Kamran is studying where do asking where do cross-sectional study fit in the pyramid. I'm going to go forward and then come back to answer this question because uh, I think I will answer this question, but at an appropriate time during this presentation. And if somebody else has any questions, please I repeat that please put uh, that in the comments section, and I'm going to go ahead and proceed with my presentation. Okay, so as we classified the studies into experimental and observational studies, and within observational studies, we will ask ourselves the question whether there is a comparison group or not. And if there is a comparison group, then it will be a descriptive study. If there is a comparison group, then that will be an analytical study. And if there is no comparison group, then that will be a descriptive study. Okay. Within descriptive studies, we will ask ourselves a question subsequently whether uh, uh, I think there's some audio problems. Let me adjust it and see from where this was coming. Okay, okay. I apologize for this. Okay, so just a minute. Give me a few minutes, a few seconds actually. Okay, I think there's some disturbance in the background and I have to adjust that. I apologize for this, and I'm going to go back to my slides. Okay, so whenever there is a we ask ourselves the question that is there a comparison group or not, and if there is a comparison group, then that particular study design is an analytical study, otherwise it is a descriptive study. And uh, when we're talking about a descriptive study, we ask ourselves the question that whether the data is a group data, or whether the unit of analysis is group or the unit of analysis is individual. And if the unit of analysis is a group, then we are talking about ecological studies. So I'm going to revise what we said that I think there's again some distortion. Yeah, I apologize for this. I think, yeah, there's some organizational matters because which are causing disruption in between, and we will improve on this online sessions as we try to do more of them to ensure that such disturbances are not occurring very frequently. So I'm just going to repeat that what we said is that did investigator assign the exposure? If the investigator assigned the exposure, then that is an experimental study. Otherwise, it is an observational study. Okay. Then within the observational studies, there is an analytical study and there is a descriptive study. And within descriptive studies, then we are going to ask whether the unit of analysis is a group or individual data. And if there is the unit of analysis is a group, and they are called as ecological studies. So I'm going to go into details of ecological studies, and I think a question was also asked related to uh, the correlation. Ecological studies typically give you correlation, and what happens that the unit of analysis is a group, which means that it can be countries, it can be cities, it can be states, or giving you an example of say tuberculosis and poverty. If we take a group level data, and what we do is that, for example, if you are sitting in the UN headquarters, and what you do, you take the data of different countries and you find out the countries, uh, uh, the income of the countries and the prevalence of tuberculosis. So you'll find out that the countries which are poor and which have low income have high level of prevalence of pulmonary tuberculosis. But that does that mean? I mean, because you are taking a country level data, and the unit of analysis is a country, it's not a individual. Therefore, that is an ecological study, and measure which will use to quantify this relationship would be correlation. It is used for generating a hypothesis. It is subject to ecological fallacy. I'm not going to, in the interest of time, I'm not going to talk about ecological fallacy in a detail, but you should know, if you want to know about it, you can Google it. And uh, uh, so subsequently, what I will do is, is there any question? If you have any question related to ecological studies, please type them in the comments, and I'm going to go move further to the next study design, which is we talked about the analytical studies and descriptive studies. Within descriptive, we talked about group level data. If the unit of analysis is a group, then that is an ecological study, and if it is an individual, that is a case report. The example of descriptive studies with unit of analysis being individual is case report, case series, and cross-sectional studies. So here is the cross-sectional study which is coming out. And there is an interesting thing about the cross-sectional study. I'm going to a cross-sectional study can be within the descriptive as well as analytical. So there is a cross-sectional study, if there is a cross-sectional study which has the unit of analysis as an individual, uh, uh, I'm sorry, I think there was some disruption once again. I think the members of the organizing team who are not able to join, I think you're trying to join again, and you're that's causing the disruption. I think if your internet is not good, please avoid joining so that the session can continue. I apologize to others for this inconvenience. For the time being, I'm just going to uh, 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 remove somebody who is causing the distortion in the sound in the background. Okay. Okay, right. Thank you very much, Kamran. I think you are saying that my voice is clear. Uh, so there are a few questions which are coming up right now, and I'm going. Let me see. Let me complete what I was saying right now, and because I was just distracted by some of the background noises, uh, I'll just complete my thought, and then I'm going to talk about the research, the questions which are coming in the comments. So what I was saying is. That there are descriptive studies and analytical study. Within descriptive, there is a group. The unit of analysis is either group, and if the unit of analysis is a group, then that is an ecological study. Okay, and if the unit of analysis is in individual, then you have case report, case series, and cross-sectional studies. I'm going to talk about the cross-sectional studies because they have a unique aspect to that. That the cross-sectional studies are in the descriptive as well as in the analytical. I mean, the cross-sectional studies can be descriptive cross-sectional studies as well as analytical cross-sectional studies. Okay. Uh, so now let's see. There are some questions in the comments. Let's first read them. Uh, so it's Zahra Rahman is saying that could you please further elaborate case report and case series and cross-sectional studies with their differences? Yes, I'm going to do that in a minute. Uh, I'm going to talk more details about case report, case series, and cross-section studies. Uh, so, what is a prospective studies? I think all of these questions, what I will do is I will revisit these questions one by one once we have talked, because most of these questions are automatically answered in the subsequent part of the talk. So I'm going to go further and continue with the slides. So, talking a bit about the case report and case series. Case report is one thing, is a one case, and if something unique is found, and you want to communicate it with the scientific community, then what you will do is write a case report. And if what you found is in the form of a combination of cases, then that is a case series. So case report or case series, that is in a situation you find something unique and different, and you want to be it to be communicated to the scientific community, then that is known as case report or a case series. That's one thing. uh, Moving further, then we have the cross-sectional study. As I told you, people, that cross-sectional studies can be within the analytical studies as well as the descriptive studies. So if we talked about it, that if there is a comparison group, then they are called as analytical studies. Otherwise, it is known as a descriptive study. So analytical studies are divided into cross-sectional studies, case control studies, and cohort studies, as well as the descriptive studies with the individual uh, level unit of analysis and individual. Uh, the study designs which we have case report, case series, and cross-section studies. So the cross-section studies are in both the camps. There, there may be descriptive cross-section studies and there may be analytical cross-section studies as well. So as I told you that there are descriptive cross-section studies whenever there is no comparison group, um, which means that you go somewhere, and if you want to find out the prevalence or the distribution of a particular condition in time, place, and person, then you use something which we call as the descriptive cross-section study. But if you want to find out an association between two factors, as we talked of the example of smoking and lung cancer, then we have to go for something we call as the analytical cross-section studies. I want to explain the cross-sectional studies with the help of this 2 by 2 table. So what will typically happen, that this is the population, and if you want to conduct an analytical cross-section study, uh, typically what you will do, you will go, and I will take the example of smoking and lung cancer. So taking the example of smoking and lung cancer, if you want to go to a population, well, it doesn't matter whether you ask about the smoking first or the lung cancer first. In cross-sectional studies, you kind of do it simultaneously, which means that you do ask about the smoking and lung cancer simultaneously and divide this population into a 2 by 2 table with 4 cells, uh, which has diseased and non-diseased and exposed and non-exposed. Okay, so it doesn't matter whether you start with exposed or non-exposed or diseased or non-diseased. Ultimately, the result is going to be the same. So that is the defining characteristic of a cross-sectional study. Um, The objective of a cross-sectional study is to, uh, the descriptive cross-section study can generate a hypothesis, but analytical cross-sectional study can be used to check an hypothesis of association between two factors. The measure of association is prevalence ratio, and we can also use the cross-sectional study to identify the factors which are associated, or a factor which can be used to predict a particular condition. Um, uh, I think I am moving a bit fast. I, I'm assuming that I'm moving a bit faster. So if you want clarification on the points which I've talked about, please feel free to comment in the comment section. I will keep moving ahead. And cross-sectional studies are easier to carry out, and they can be very useful if data is collected wisely. And one thing, it's important, and there was a question as well. I think that this is the right time to talk about that question. Let me identify that. So Muhammad Kamran asked this question, that where do cross-sectional studies lie in the pyramid? Let me project the pyramid first. So as you can see that the cross-sectional studies, though have not been mentioned over here, but they are definitely, yeah, I think they should be mentioned after the case series and case report. They're better than case series and case report, but uh, inferior to case control studies. But now there is an important tricky thing, that you cannot make it a rule of thumb. What you can do is, if you have a very good set of tools, okay, then a well-designed cross-section study can be very useful. It's not a rule of thumb. It's just choosing the right study design for the right decision. And with the right study design, what you can do, uh, if you at a particular situation, a well-designed cross-sectional study much maybe better than a case control study as well. And one of the important factors in improving the rigor of the cross-sectional study is the tools which you use for data collection. The measure of association which can be used for a cross-sectional study is odds ratio or prevalence ratio. Uh, the subsequent analytical study is a case control study and the cohort study. So we are going to talk about the case control study. And I think uh, the defining characteristics of the case control study is uh, that you start with a case, you recruit the cases, and then you recruit controls on the basis of those cases. There's a population from which you can take the cases, and there is a separate population from which you take the controls. And from both of these groups, you ask them about the exposure. Okay, so that's what it is. Like taking the example of smoking lung cancer, I will go to the pulmonology clinic and I will recruit the cases of lung cancer uh, from the pulmonology clinic, and I will also recruit the controls from maybe another clinic, maybe endocrinology clinic, or maybe internal medicine clinic. And for both of the groups, I will ask whether the cases are exposed to smoking, whether the cases have smoked or not, and whether the controls have smoked or not. Okay, and so that's how the 2 by 2 for the case control studies is constructed. Therefore, the defining characteristic of the case control study is that you start with the disease, ask about the exposure. It is subject to something which we call as the recall bias. The measure of association in the case control studies is the odds ratio. And typically, the research question in the case control study is that is there an association between two factors, which in this example was the smoking and lung cancer. And typically, you use case control studies in this situation is used for conditions which are rare, and by rare we mean that the population prevalence of that particular condition, if it is less than 10%, then it is preferable to use case control studies as compared to the cross-sectional studies. So if I want to explain it in connection to what I said previously, I told you people that if the word association is used in case control studies, what you will do is you have the option of so for example, if let's assume if the word association is used in the stem of the research question, then you have the study design option of either conducting a case control study or a cross-sectional study. I mean, the deciding factor whether to use a case control study or a cross-sectional study is whether the disease prevalence is less than or greater than 10%, or if the exposure data is expensive, then you still will like to prefer doing case control studies as compared to the cross-sectional studies, or if the disease has a long incubation period, or if little is known about the disease. So these are all the conditions in which you will conduct prefer a case control study or cohort study. uh, the next study design is within the analytical studies is cohort study. And in the cohort study, the typical word which we use in the stem of the research question is causation. As in taking the example of smoking and lung cancer, we'll ask the question whether smoking causes lung cancer or not. So, what you will do typically, because you want to establish what we call in epidemiology as temporality, what you will do, we'll start with a group which are smoker and non-smoker, which means that they're exposed and they're not exposed. Okay, and you have to ensure that at the baseline, every person is disease free. So there are going to be three characteristics. These individuals are going to be exposed and non-exposed, and they will be disease free. Okay, and then you will follow them up for a particular period of time, and some of these individuals will develop the disease and others will not develop the disease, and ultimately will make the 2 by 2 table for the cohort study. But the defining characteristic of the cohort study is that you start with the exposed and you uh, start with the unexposed population and ensure that they are um, disease free to the baseline. So it's a right time to refer to this question. All these are types of prospective studies? No, only cohort study. The term prospective can only be used for cohort studies, because um, even in the if we go further into the details of the cohort study, we have a prospective cohort, we have a retrospective cohort, and we have other types of cohort studies as well. But when we use the term prospective studies, that means that we are talking about a cohort study where we start with the exposed and the unexposed population, and we follow them up for a particular period of time and identify how many of those who are exposed develop the disease, and how many of those who are not exposed develop the disease. Okay, so there is another question. I think it's the right time to come to that as well. And in between, I think we are almost to the end of the time. We just have approximately 10 to 12 minutes left. So if you people have any questions, I will be giving some time to the questions as well. So please, it's the right time to write your questions and I will refer to them. So this is a question: can a cross-section study be a cohort study? Simple answer to this is no. A cross-section study is in its is a separate study design. Cohort study is a separate study design. So the simple answer to this is no. A cross-section study is separate from a cohort study. Um, so the defining characteristic is that it starts with the exposure, divides the exposed and non-exposed into diseased and non-diseased. It's comparatively, and I think among the descriptive studies, it is the most robust study design. It establishes temporality, which means that it establishes the fact that exposure preceded the outcome. Therefore, uh, if you um, study in fourth year, if you are in fourth year, you have heard of something we call as the Hills criteria to establish causality. And one of the criteria which was developed by Hills, a famous epidemiologist, was that in order to establish causality, that particular exposure should have temporality, which means that it should precede the outcome. Since this establishes cohort studies establish temporality, therefore it is um, helping us to establish causality. But ultimately, causality, development of causality, requires the fulfillment of many other factors. It's not only temporality, but temporality is one of them. The measure of association is risk ratio or rate ratio. You can also find out the population attributable risk, which means that what proportion of uh, a disease is because of that particular factor. Taking the example of gain of smoking and lung cancer, we will be able to identify with the help of the cross-section study that, not with the help of the cross-section study, I'm sorry, with the help of the cohort study, that one proportion of the diseases, disease in the population is because of smoking. In other words, if smoking is stopped, what percentage of the lung cancer cases will be prevented? And it is used in rare exposures and short follow-up time. So this is the classification which I was talking about. Within the experimental study design, which as a reminder, we have talked about that whether you will ask yourself the question that did investigator assign the exposure or not. Okay, and in that case, there are different experimental studies, which include randomized controlled trials, quasi-experimental study design, crossover study design, factorial study design, stepwise study design. And just for the sake of simplicity and in the interest of time, we are not going to talk about the adult study design. We will be only talking about the randomized controlled trials. Though within the randomized controlled trials, there are different types of randomized controlled trials. There are simple randomized controlled trials and there are cluster randomized controlled trials as well. So what do we do in randomized controlled trials? There are different types of treatment. Again, for the sake of simplicity, I will say that there is a treatment A and treatment B. Um, you take a population, you allocate individuals randomly into treatment A and treatment B, and then decide uh, uh, some of the individuals will uh, develop an outcome among the treatment A arm, and other will develop an outcome in the treatment B arm. So that is how it will happen. So ran- the defining characteristic of a randomized control trial is the random allocation, which does the favor to the investigator that it adjusts for confounding. For the timing, again, I'm not going to talk about what is confounding, but uh, eh, just as a over simplistic explanation is that is a factor or a combination of factors that confuses the results. The word confounding is from confusion, and it distorts or confuses the results. So what randomization does is it equally distributes the confounders in the two arms, and it establishes temporality and causality. The disadvantages of randomized control trials are that quite costly, and they have the issues with generalizability, which means that they can be applied to the population on which the study was conducted. Uh, uh, because there are a number of ethical considerations related to confounding, and the research question needs to follow a strict criteria, PICO criteria, uh, which means that, but the downside of following a strict PICO criteria is that it will also be generalized to only a particular narrow population set on which from which the sample was taken. So these are the disadvantages of uh, randomized controlled trials. So again, this is the hierarchy of evidence which I talked about. Um, there are other study designs which I'm not going to go into a lot of detail. Some we may talk about that in detail in the subsequent sessions to avoid confusion, because and to avoid a lot of information load. There are narrative reviews and systematic reviews, and also meta-analysis. It's good to know these terms for the time being, but we will talk about them in the subsequent sessions. So I would wait if there are any questions. If not, uh, I think I couldn't see any new questions. Let me just revisit and see if I've not answered anything. And I will bring in the host to the screen as well. And just bear me with me for a minute. I think the host is dropping again and again because I think of the issues in connection at her end. Uh, I think I've almost answered all of the questions, so there are no new questions. May I request the hosts to please come on the screen and conclude the session? Uh, if Sana, you are hearing, are you available to come to the screen and conclude the session? Sana, you can conclude the session.
Okay. Thank you so much, Dr. Amir. This was indeed a very informative session, and I believe the audience believes the same. We look forward to more such sessions, and I again thank you very much. We'll now end this session with Dua Imam Zamana. For this, I would want to request Abid Raza to please take over.
الرحيم. اللهم كن لوليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرزك طوعا وتمتع فيها طويلا برحمتك يا أرحم الراحمين.
Jazakallah.
Okay, thank you very much. Allah Hafiz.
Allah Hafiz.